Managing high blood pressure usually involves one or a combination of five primary drug classes. Think of your circulatory system as a plumbing network. To lower pressure, you can either reduce the amount of fluid in the pipes or widen the pipes themselves. Here's a simple breakdown of the big five. Angiotensin converting enzyme inhibitors. These block the production of a hormone called angiotensin 2, which normally tells blood vessels to tighten. By blocking it, vessels stay relaxed and open. Lisinopril, enalapril, ramipril, and other prils. A persistent dry ace cough due to the buildup of bradykinin in the lungs and occasional high potassium levels are the main side effects. Often the first line for patients with diabetes or diabetes with chronic kidney disease, as they provide extra protection for the kidneys. But there is a risk of hyperkalemia with renal insufficiency. Angiotensin receptor blockers. Instead of stopping angiotensin 2 production, they block the receptors where the hormone attaches. Examples are losartan, valsartan, and telmisartan, the sartan family. Main side effects are not many. They don't have the typical cough. They may still raise potassium level. Often used for patients who need the benefits of an ACE inhibitor but couldn't tolerate because of cough. Calcium channel blockers. Calcium helps the muscles in your heart and blood vessels contract. These drugs prevent calcium from entering those muscle cells, which allows the blood vessels to relax and dilate. Common examples are amlodipine, nifedipine, and diltiazem. But for hypertension, mostly it is amlodipine, nifedipine, and other congeners, and not diltiazem. Angle edema, especially with amlodipine, is the most common side effect, and there can be flushing or headache as well. They are particularly effective for elderly patients and black patients who often respond better to calcium channel blockers than ACE inhibitors as an initial treatment. Thiazide diuretics are often called water pills. They prompt the kidneys to flush out excess sodium and water from the body through urine. Less fluid in the blood means less pressure on the vessel walls. Hydrochlorothiazide and chlorthalidone are examples. Side effects include frequent urination, low potassium, sometimes increased blood sugar or uric acid, which can trigger gout. They are a first-line use drug, classic, cost-effective, first choice for general hypertension, often used in combination with other drugs. Beta blockers. These block the effects of adrenaline. They make the heart beat more slowly and with less force, reducing the pump pressure. Common examples are metoprolol, atenolol, and bisoprolol. Side effects include fatigue, cold hands and feet, potentially masking the symptoms of low blood sugar. While no longer always a primary first line for simple hypertension, they are essential first line treatments for patients who also have heart failure, where the use is with lower dose and with caution, or have a previous heart attack. Note that treatment is highly individualized. Doctors often use a low and slow approach, starting with a low dose and potentially combining two classes like ACE inhibitors and a calcium channel blocker to maximize effect while minimizing side effects. Rapid increase in dose, especially in chronic hypertension, can cause symptoms which were not there when the hypertension was present.